Hi friends, welcome to Interactive Medicine. In this section, we are going to talk about the neonatology, the introduction. We can start. Neonatology is a subspecialty of pediatrics that consists of medical care of newborn infants, especially the ill or premature newborn, up to 28 days after birth. That is important. Up to 28 days after the birth. Okay. Neo. Neo means new, or natal means pertaining to birth or origin. It is a hospital based specialty and is usually practiced in neonatal intensive care unit. Neonatal intensive care unit. Neonatal period. The neonatal period commences at birth and ends 28 completed days after birth. 28 completed days after birth. Early neonatal period, first to 7 days, and late neonatal period is 7 to 28 days of life. First to 7 days important, that is the early neonatal period, and 7 to 28 days of late life, that is late neonatal period. So the neonatal period is divided into two, and the first 7 days is going to be early neonatal period, and after 7 days to approximately 1 month, that is late neonatal period. Then there is another period also there, that is perinatal period. Perinatal period commences at 22 completed weeks, that is 154 days of gestation, the time when birth weight is normally 500 gram and ends 7 completed days after birth. The classification based on gestational age, which include preterm, term and post-term. The term is normally between 37 to 42 weeks, and if it is less than 37 weeks, then it should be preterm, and the post-term, what we can say, it is greater than or more than 42 weeks. Classification based on birth weight. The normal birth weight is 2.5 to 3.5 kilogram, and low birth weight we considered when it is less than 2.5 kilogram. Large for gestational age we consider as if the weight of the baby at the time of birth is more than 4.2 kilogram. The components of neonatal care, which include the most important, the one is the patient, or the here the baby, and we have the doctors and consultant, and of course we have the parents of the baby and the nurses who supports for doctors and consultants. The components of NICU, or neonatal intensive care unit, which include what? The incubator, baby crib, the warmer. Components of NICU, which include ventilator, CPAP or continuous positive, air it which is it is actually mask which helps to give the oxygen or air to baby, and it is continuously positive in air pathway. And we have the suction, and we have the oxygen. Then there is phototherapy, belly blanket, phototherapy light. The common cause of NICU admission, the common cases of NICU admission in case of respiratory distress syndrome, neonatal jaundice, neonatal sepsis, preterm, hemorrhagic diseases, CNS problems, meconium aspiration, pre and post-operative cases. The procedures in the NICU, which include endotracheal tube, chest intubation, IV cannula, umbilical catheter, blood transfusion, phototherapy, exchange transfusion, history taking, which include the name, the mother's name or father's name, gender, male or female, or ambiguous genitalia, and the sibling, which have the history of other siblings, the IUD, abortions, RH, ABO incompatibility, metabolic genetic diseases, consanguinity for congenital abnormalities, mode of delivery, it may be normal vaginal delivery or low section cesarean, low segment cesarean section. Then gestational age, full term or preterm, Ballard maturational assessment based on gestational age based on Ballard maturational assessment. We can determine its full term or preterm. Age of the baby, then maternal risk factors. We do GP system. Okay, mode of delivery. It's maybe normal vaginal delivery or cesarean section. If it is in cesarean section, the cause anesthesia more liable for RDS. Then normal vaginal delivery, obstructed labor, traumatic labor, less liable for RD. Maternal risk factors: maternal age less than 18 years or greater than 35 years. Social demographic factors: low educational status, cigarette smoking, drug addiction, poor nutrition, poverty. Obstetric factors: previous cesarean section, multiple pregnancies, prior infertility, blood transfusion. Medical conditions include diabetes mellitus, hypertension, pregnancy-induced hypertension, preeclampsia, congenital heart diseases, autoimmune diseases, infections. Okay, so above mentioned cases are the maternal risk factors where the baby can be put into ICU. Okay, and mortality rates, definitions and the measurements. Okay, the live birth, complete expulsion or extraction from its mother of a product of conception, irrespective of the duration of the pregnancy, which after the separation breathes or shows any other evidence of life, such as beating of the heart, pulsation of the umbilical cord, definite movement of voluntary muscles, whether or not the umbilical cord has been cut or the placenta is attached. Each product of such a birth is considered the live born. And fetal death, stillbirth, death prior to the complete expulsion or extraction from its mother of a product of conception, irrespective of the duration of the pregnancy. The death of indicated by the fact that after such separation the fetus does not breathe or show any other evidence of life, such as beating of the heart, pulsation of the umbilical cord, or definite movement of the voluntary muscles. Perinatal mortality, an important indicator of maternal care, maternal health and nutrition, quality of obstetric pediatric care. Perinatal mortality. Perinatal mortality rate, the number of deaths of fetuses according to reporting criteria, plus the number of early neonatal deaths per 1000 total births. So fetal and early neonatal deaths divided by total births into 1000. Neonatal mortality. Neonatal mortality rate. The number of death of infants during the neonatal period per live births. Neonatal deaths divided by live births into 1000. Neonatal mortality. Early neonatal mortality rate. The number of early neonatal deaths during a given year per 1000 live births in the same year. Early neonatal deaths divided by live births into 1000. Postnatal mortality. Post-neonatal mortality rate. The number of deaths of infants aged 28 to 364 days per 1000 live births. Post-neonatal deaths divided by live births into 1000. Infant mortality. Infant mortality rate. The number of deaths of infants aged less than 1 year per 1000 live births. Deaths under 1 year of age divided by live births into 1000. Child mortality. The most important is under 5 mortality rate. Under 5 means the child died the age less than 5. It is the leading indicator of the level of child health and overall development in countries. The fourth indicator of 8 MDGs, Millennium Development Goals. Under 5 mortality rate. Under 5 mortality rate. The number of deaths of children aged less than 5 years. That is important. Less than 5 years per 1000 live births. The deaths under 5 years of age into 1000. That is under 5 mortality rate. Okay, I think this video is helpful for you, and if you have any doubt you can add on the comment section. Please subscribe our channel and give a like button and share to your friends. Thank you so much. Bye.